This article addresses the clinical features of topical steroid withdrawal, also known as red burning skin syndrome. The following are a few of the key elements addressed in the article. How is steroid addiction defined? Topical steroid addiction refers specifically to topical corticosteroid addiction. It is a rebound phenomenon that can affect the entire body surface. The skin develops a worsening reaction after the withdrawal of topical steroids. What are the clinical findings of topical steroid addiction? Before withdrawal, addicted skin usually looks normal or well controlled by steroids. Some patients notice that the topical steroids are not working as well as they used to, and that the itching has increased over time. This is a symptom of addiction. After withdrawal, the skin becomes red and inflamed. It often develops from the original area of eczema and continues to spread daily. This rebound eruption progresses to areas of the skin where topical steroids were never applied. It can spread from one eczematic finger to the entire body, even though the patient had no other areas of eczema and only used topical steroids on that one finger. The rebound period can last up to several months, gradually lessening as time passes. Mild cases may consist of flushing or redness, while severe cases can include a myriad of symptoms, including oozing, papules, pustules, and fever. After the acute phase, a dry, itchy phase follows, often with thickened, shedding skin. Patients often become depressed and pessimistic during this period due to the severity of the symptoms and because doctors do not know how to treat them without recommending more topical steroids. The skin gradually improves, however, although it becomes very sensitive and reactive. Over time, this sensitivity lessens and the skin normalizes. The entire course can take from weeks to years. What strength of steroid and usage pattern leads to steroid addiction? Longer periods of application and more potent strength of topical steroids leads to more frequent addiction. Concrete data is very difficult to obtain because patients usually do not have a record of the applied topical steroids. How is steroid addiction treated? Topical steroids must be withdrawn in addicted patients. However, because addiction is not recognized among dermatologists, patients cannot expect much assistance from them. Patients often stop taking steroids on their own because they notice that the steroids are not working as before, only to develop an unexpected severe rebound. Only then do they visit their dermatologists. Often, doctors diagnose this as an aggravation of the original skin disease due to abruptly stopping steroids. They then strongly suggest the use of more potent steroids, continuing the addiction.